We published paper 2 years ago. It was in Journal of Orthopedic Translation. Impact factor is 6.6, which is a good journal in orthopedic field. The topic was about analysis of morphometric change in the uncinate process of cervical spondylosis patient. It was study of radiological anatomy. The purpose of our study, there is a lot of research that focus on the relationship between the uncinate process and vertebral artery, but there is no relation, there is no population considering that the difference between the uncinate, the change uncinate process between the normal and the degenerative patient. And also there were no anatomic parameter that can use to guide for the procedure in intervertebral foramen decompression. And also we analysis of the morphometric change of uncinate process of the cervical spondylosis patient. The method was 40 patient, 20 patient was normal, and 20 cases was degenerative cervical group. There was 6 parameters. The first one is from midline to the from the vertebral midline cervical to the medial of pedicle cortex. And the second parameter, it was from the medial to the lateral of the medial for the pedicle cortex. The third one was about the height of the uncinate process, the minimum height. And the fourth parameter, it was the maximum height of point of uncinate process. The fifth parameter was from medial line to the medial border for uncinate process. And the last one, it was from the midline to the lateral point of the uncinate process. We got some result. What we will use it in the surgery as guideline. This was our result. The conclusion of the study, in this retrospective study, our results suggest that for the patient who suffer from cervical spondylosis could be performed foraminotomy decompression by resecting part of uncinate process. And we got the safe buoyant of the spinal canal was about 6 width between the inferior vertebral artery and end plate. And the up of the uncinate process was 5 millimeter. We can resect the uncinate process without interfering of the spinal nerve root and vertebral artery. The translation potential of our article, our study found the safe margin performed foramen decompression to the uncinate process for the cervical spondylosis patient. Also, this may help to improve safeness of the surgical procedure, and also we provide data for the future robotic study. This is our hospital was in, this was robotic This is like in our hospital now we are freehand for doing the fixation, whatever thoracic or lumbar. We totally freehand it. In our hospital we do it by robotic machine. We connect it by CT, pre-operative CT for the patient, and we connect it before operation and totally freehand. No need to do anything and the error for this machine is 0.001. It's totally safe. And this is post-operative, and we just only do the mark and some hemostasis liquid only, and it's doing by robotic surgery. And this is post-operative, all is many invasive surgery. No need to open a big incision or whatever. And this is we also provide some data for spine endoscopic surgery. This is one case for patient have lateral disc for right side. And this is the patient CT. As you see, is like have a big disc. And this is what we do, is like we have mark under CM for one time, for one shot or two shot X-ray. This is the work sleeve for endoscopic. And this is after doing the endoscopic. As you see, this is the nerve root. It's totally free. And this is the, we called it keyhole procedure, posterior cervical keyhole procedure. As you see, this is, we have only many hemilaminectomy is like small hole, and through this hole we go and we do decompression for the nerve, and we have also removed the disc from this. And as you see, this incision, some of doctors, they do it under local anesthesia for cervical also. No need to generalize anesthesia. And this is the reference. Thanks.